The GHA says the use of 111 in this way creates a single point of contact through which crisis mental health services can be accessed and facilitates a quicker, more effective response. The phone line, it says, is a first step, with a team of doctors, nurses and clinical professionals on hand to provide support. The Minister is confident the necessary resources needed for the system to work are available.
The GHA has a lot of resources, particularly when it comes to mental health. As a government, we have invested in mental health greatly, both in terms of capital investment in a new building, as well as investment in human resources, and our complements have been growing year on year. This is a question of coordinating the existing assets that we have in the people that we have in a much better way, and this will translate into a more effective response to the public.
You've had the mental health report, of course, and we've heard of how long people have to wait for an appointment to see somebody. There hasn't been anybody to see them. So why suddenly now? Why is this okay now?
Well, this is an improvement. As you know, we commissioned the mental health situation report so that we could see where our gaps were, so that we could work on improving the system that we have. One of the recommendations in the report was that we provided a system that was better coordinated, and this is a way to better coordinate those who are in crisis and those who need mental health support. When someone calls the 111 line, the call will be triaged. The call will be assessed, and then the response will depend on the situations. If it's an absolute emergency and an acute call, an ambulance will be dispatched immediately, for example. Or alternatively, if it's urgent but less acute, then they will be seen within 30 minutes, or they could be seen the following day. Let me give you an example. We've had a debrief on yesterday. We launched this yesterday, so we've had a debrief this morning to see how yesterday went. Yesterday, 4 people called the helpline, and all 4 were seen either yesterday or they've been seen already this morning.
I'm sorry, Minister, but doesn't this beg the question of why weren't they being able to have been seen when this happened last month?
This is a new service and this is a new pathway. What we are doing is we're looking forward. We're looking to see how we make things better. Are you criticising the fact that we've improved the service and have a much better streamlined service?
I'm not criticising anything. I'm just expressing people's concerns that yes, you have a telephone number, you have a triage system, but then you won't have the people to actually handle it.
Well, those concerns, I think I regret that those concerns have been expressed without it being evidenced. This is a system that we've commenced yesterday, so the evidence as from yesterday is that it works. Obviously, it's something that we're going to be monitoring. I want to make sure that it works. I wouldn't have launched this wanting it to fail. We want it to succeed, and I'm sure you want it to succeed, and I'm sure that the community wants it to succeed. So let's give it a chance. Instead of everybody trying to make it so negative and everybody trying to find a way to criticize it, let's make sure it works. I will make sure it works. The GHA is a system that provides a service. I will make sure that the service is provided because it needs to be provided. What we'll do is we'll assess the situation at the end of the week to see how it's gone. Obviously, we'll monitor it, we'll review our statistics to see how it's going, to see how we can learn from our practices to improve it. I've already asked for a report for the end of the month to see how it's gone, and obviously, the end of next month. And then I've asked for a 3-month report as well, and we'll do a proper debrief in 3 months' time to see how it's working. I'm confident that it works. The team have been training and planning this for approximately 2 months. They want it to work. Everyone is extremely motivated for it to work, and I'm sure that it will. I'm confident that it will.
And she expressed confidence in the mental health professionals, who she said had joined the profession to help others.